Hi, my name is Samantha Montalegre, and welcome to the Maternity Mentor. Today's topic is choosing your ideal birth location. Thanks for joining us. Today we will be discussing choosing your ideal birth location. For anyone who doesn't know me, I have been a registered nurse for 11 years. I've spent my entire career working in the maternal newborn nursing area, including mother-baby postpartum, NICU, antepartum, and labor and delivery. I have practiced as an IBCLC for 8 years and have been maternal newborn nursing certified for 7 years. I have also received specialized training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Delivery plans are not just about who will take care of you during your pregnancy, but also where you will give birth. There are 3 places you can choose to give birth in: hospitals, birth centers, or your own home. Today, we will examine all 3 of these locations, including what to expect and advantages and disadvantages when choosing a birth location. Let's start with a hospital birth. Giving birth in a hospital is still the most common place to deliver a baby. While some hospitals have mother's labor in one room and deliver in another, most hospitals have now converted to LDRs, or labor, delivery, and recovery rooms. Rooms are usually decorated to be warm and comfortable, with a sofa for the birth partner to rest on. Many rooms will include a shower or jacuzzi tub to assist with the labor process. The entire birth process will take place in this room, and the mother-baby couplet won't be moved until 1 to 2 hours after recovery. Hospital births can offer a variety of options for mothers, including management of high-risk deliveries, being close to an operating room in case a cesarean section is needed, and a variety of pain management options, including epidurals. The most advanced technology is available in the hospital, including ultrasonography, blood pressure screening, maternal fetal pulse oximetry, infusion pumps, and electronic fetal monitoring, which is routinely used during the entire labor process. Advantages of a hospital birth include: many mothers feel safest laboring in a hospital setting. It is the safest environment for the mother at risk for medical complications during labor, and emergency personnel and equipment are available if the mother or baby needs medical attention. It avoids the rush of a last-minute transfer to the hospital from a home birth or a birth center if medical problems arise. It is the only option in the event a cesarean section is necessary. And immediate pediatric attention is available should the newborn need medical care. In addition, newborns do not need to be taken off-site to be routinely examined by a pediatrician. And hospitals have round-the-clock help for mother and baby, including meals, assistance with baby care, medical care for mother and baby, and education and information about postpartum care. Hospitals also have a variety of personnel that are available to assist with the care of both mother and baby, including OBGYNs, certified nurse midwives, perinatologists, registered nurses, nursery staff, pediatricians, and lactation consultants. Some hospitals will also have a specialized intensive care unit for babies with staff including neonatologists and NICU staff. Hospital births have disadvantages as well. Usually hospital births cost significantly more than other birth locations. While some deliveries can be as little as $3,500, the average cost ranges around $10,000 and can be $30,000 or more with complications. Hospitals have an increased cesarean section rate. The cesarean section rate is as high as 31.7% according to the CDC. Hospitals also have an increased rate of labor induction and labor augmentation. There is also an increased episiotomy rate in the hospital birth. The rates range from 1 to 40%. An episiotomy is a surgical incision of the perineum during the second stage or pushing stage of labor to quickly enlarge the vaginal opening for the baby to pass through. The epidural rate is also high in hospital births, depending on the state you live in, with ranges from 35 to 79% of births. Most research suggests that some babies will have trouble latching on, causing breastfeeding difficulties after the mother receives an epidural. Other studies suggest that a baby might experience respiratory depression, fetal malpositioning, and an increase in fetal heart rate variability after an epidural. This can increase the need for forceps, vacuum use, episiotomies, and cesarean deliveries. Additional disadvantages of a hospital birth include parents do not have the same control they would at home. Hospitals are primarily associated with illness. Therefore, a mother's birth is usually managed by experts trained in pathology, not birthing as a natural process. Hospitals can seem impersonal and intimidating, and they have rules, policies, and red tape which are rarely altered to accommodate an individual. There is also less privacy available in the hospital, and fathers are sometimes less actively involved in a hospital setting and may feel like an outsider. Some routine separation of the mother and baby is almost unavoidable, and most hospitals do not allow the mother to rest. Finally, the risk of complications and infection due to medical intervention is greater among mothers who deliver in hospitals than among those who give birth at home or in a birthing center. Now let's talk about giving birth in a birth center. Giving birth in a birth center is not as common as a hospital birth, but still a popular choice. Rooms are usually decorated to be warm and comfortable with a relaxed atmosphere. Many rooms will also include a shower or jacuzzi tub to assist with the labor process. The rooms are designed to make you feel like you are laboring at home. Birth centers also utilize advanced technology, but to a lesser extent than a hospital. Birth centers employ natural birthing techniques and positions not normally seen within the hospital setting. They provide an alternative to parents who are not comfortable with a home birth but do not want to give birth in a hospital. Advantages of a birth center birth include birth centers are focused entirely on pregnancy and birth events. Pregnancy and birth are considered a natural and healthy process. Birth centers offer a more personalized type of care at much lower costs than traditional hospital births. Parents are encouraged to bring family members to their prenatal visits, and in most birth centers, parents can meet the entire staff prior to the birth. Women are encouraged to take charge of their own health care in the birth center. Some other advantages include parents have greater control in the birth process. Obstetric care is less interventive and invasive. Mothers are allowed to eat during their labor, and mothers can move during labor and give birth in any position they choose. Parents can usually have as many family and friends attend the birth as they want. Birth centers have reduced rates for cesarean sections, forceps deliveries, and episiotomies. The discharge time after birth is normally measured in hours, not days. Disadvantages of delivering at a birth center include a rigid screening criteria that often eliminates healthy mothers from delivering in this location. For example, birth centers may not accept a mother over 35 years of age. Birth centers also may not allow a VBAC. A VBAC stands for vaginal birth after cesarean. A VBAC often has lower risks for delivery compared to a repeat cesarean section. However, there are risks inherent with a VBAC, and not all women are eligible, which is why birth centers often refer these women to the hospital. While many hospitals are increasing the availability of VBACs, not all physicians will allow for a VBAC to take place. This necessitates the need for a cesarean section. Other disadvantages of utilizing a birth center include mothers still must leave their homes to labor in a separate location. Many birth centers have rigid rules and protocols about when to transport a mother to the hospital. Reasons can range from prolonged labor to prolonged rupture of membranes or even a temperature during labor. Additionally, the mother may have to be transported during active labor, which can be very uncomfortable. Birth centers usually do not have pediatricians on staff. This means if the baby has special needs after the birth, the baby may need to be transferred to a hospital. Finally, mothers cannot stay at the birth center for a 2 to 3 day recovery as is standard in a hospital. Discharge is usually within 4 to 24 hours. Finally, let's talk about home births. Statistics show that home births are as safe or safer than a hospital birth. This applies to low-risk women with adequate prenatal care and a qualified birth attendant. A woman is able to labor and deliver in the privacy and comfort of her own home. Mothers can choose to be surrounded by any family, friends, or even children they want present. They can labor in whatever positions they want, and she can wear whatever she finds most comfortable. The laboring woman maintains control over everything impacting her labor and birth. Those present during labor and delivery are focused only on the needs of the mother. Nothing is done without a woman's informed consent. Advantages of a home birth include labor being allowed to progress normally and naturally without interference or unnecessary interventions. There is a reduced risk of infection for both mother and baby. Mothers are encouraged to eat, drink, walk, change positions, make noise, shower, and bathe. Caregivers are invited guests in the birthing woman's home. Caregivers come to her, not the other way around. The care provider knows the woman well, and the mother knows her care provider. They have established a relationship based on trust and respect. The mother's medical team usually consists of a certified nurse midwife and a birth assistant. This team does not go home because their shift has ended, or because it was supposed to be their day off, or because they planned something else. Continuous one-on-one care is given by the midwife. They provide ongoing assessment of the mother's and baby's conditions throughout the birth process and postpartum period. Bonding is enhanced and includes everyone who is in contact with the mother and baby, including neighbors and relatives. Breastfeeding is facilitated by the baby remaining with the mother. Rates are low for transportation to the hospital, cesarean sections, and episiotomies. Finally, the cost of a home birth may be less than a hospital birth, and home births are often covered by insurance when being delivered by a certified nurse midwife. Disadvantages of a home birth can include women must assume a greater level of responsibility for their own health and medical care. This requires active, ongoing participation in decision-making with the medical team they choose. Additionally, parents must be willing to accept the consequences of these choices and decisions. Choosing a home birth may draw negative judgments and criticism from family and friends. The cost of a home birth may not be covered by a woman's insurance. Finally, many interventions are not available during a home birth, including cesarean sections, forceps deliveries, epidurals, blood transfusions, and neonatologists or pediatricians available immediately to attend the baby after birth. If any of these interventions are needed, the mother and/or baby will need to be transported to the hospital. Parents are responsible for postpartum care, including meals, housekeeping, baby care, and sometimes even lactation assistance. Please be aware, none of the information we have reviewed applies to all hospitals, all birth centers, or all home births. There are plenty of wonderful caregivers who nurture and develop a close, trusting bond with their patients in all of these locations. Additionally, services mentioned can vary from provider to provider, so it's very important for you, the patient, to do your research and choose a provider and location that's right for you. For more information on how to choose a provider, please view our OBGYN versus midwife What's the Difference video. I will link that video here and in the description below. We hope this information will help you in finding the right location to deliver your baby. Please share your comments below and feel free to let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.